Welcome to another episode of Optimal Anesthesia, the podcast where we delve into the fascinating world of pharmacology. Today, we're exploring a captivating topic: anesthesia pharmacology in pregnancy. Pregnancy is a remarkable journey, not only for expectant mothers but also for healthcare professionals. It's a time when pharmacology takes on a whole new level of complexity. In this episode, we'll unravel the intricate dance between pregnancy and anesthesia pharmacology, discussing how the changes in a pregnant woman's body affect the way drugs are absorbed, distributed, metabolized, and eliminated. Let's start with the changes that impact drug absorption and uptake during pregnancy. Picture this: the gastrointestinal transit time is extended by 30 to 50%. This means that any orally administered medications might take a little longer to kick in. On top of that, the increase in gastric pH can play with the absorption of drugs that are weakly acidic or basic. Not to forget, the heart pumps more blood, leading to enhanced drug absorption through skin and mucous membranes. And let's not overlook the fact that increased alveolar ventilation makes inhaled anesthetics work a bit differently during pregnancy. Moving on to drug distribution. With the cardiac output going up, drugs are delivered to peripheral tissues more quickly. However, it may take a bit more time to reach therapeutic levels in the brain and arterial blood. The expanded total body water and plasma volume cause an increase in the volume of distribution, VD, for many drugs. This is especially relevant for hydrophilic drugs that require higher initial doses. But the plot thickens for lipophilic drugs. They tend to accumulate in adipose tissue, which can lead to sustained high drug concentrations. During pregnancy, a remarkable change takes place in a woman's body. One of the key alterations involves a substantial decrease in serum albumin levels. Serum albumin is a protein in the blood responsible for binding to various drugs. The decrease in serum albumin during pregnancy has a profound impact on drug binding. Specifically, it results in reduced binding of weak acidic and lipophilic drugs. This reduction in protein binding means that a higher concentration of the drug becomes freely available in the bloodstream, ready to exert its pharmacological effects. The implications of reduced protein binding don't stop there. It can influence drug clearance, a critical aspect of pharmacokinetics. With more free drug available, the potential pharmacological effects of medications may be amplified, which can be both a benefit and a challenge. But there's more to this story. Hormonal changes during pregnancy, such as increased levels of free fatty acids and placental hormones, can further displace drugs from their binding sites. This displacement can have a significant impact on the pharmacokinetics and dynamics of drugs administered to pregnant patients. Pregnancy shakes things up in the liver too. Increased hepatic blood flow influences hepatic clearance, which can alter the metabolism of drugs dependent on this route. On top of that, different cytochrome P450, CYP450, enzymes start acting differently. Some become more active, influencing the metabolism of drugs like phenytoin and morphine. Others slow down, affecting substances like caffeine. Knowing these changes can be a game changer for drug dosing and selection. What about drug elimination, you ask? Increased renal blood flow and glomerular filtration rate, GFR, during pregnancy can significantly affect the clearance of drugs excreted unchanged by the kidney. This might require dose adjustments for medications like digoxin and lithium. And, due to the increased minute ventilation, inhaled anesthetics can be eliminated faster, which directly impacts the depth and duration of anesthesia. Finally, we dive into the mysterious world of placental drug transfer. It's crucial to understand that drugs given to the pregnant mother can cross the placenta and affect the developing fetus. The concentration gradient, placental blood flow, and the duration of exposure play vital roles in determining the extent of fetal drug exposure. And differences in blood composition between the fetus and the mother, such as albumin, pH, and ionization, can impact drug transfer. In some cases, like severe fetal acidosis, ion trapping may occur, affecting drug accumulation in fetal tissues. Understanding the intricate interplay of pharmacokinetic changes during pregnancy is essential for anesthesia pharmacology. These changes not only impact the way drugs work but also require careful consideration when selecting the right medications and determining the appropriate dosages for pregnant patients. And that's a wrap for this episode of Optimal Anesthesia. I hope you found this journey through anesthesia pharmacology in pregnancy as fascinating as I did. Stay tuned for more intriguing topics in the world of pharmacology.